Hi, Dr. Nanasco here to talk to you briefly about the importance of preparing both yourself and your home for your upcoming recovery. We may have you get labs or further medical screening to make sure your body is ready for both surgery as well as recovery. You may work with your primary care provider or another specialist based on the medical screening process. Please make sure you follow these recommendations as we want you to be in the best shape as possible to recover. Ahead of surgery, we will ask you to stop certain medications, supplements, or vitamins to help minimize complications during surgery or during general anesthesia. One of our biggest concerns is bleeding risk. Therefore, we advise stopping the use of NSAIDs or nonsteroidal anti-inflammatories before surgery. Even after surgery, follow your surgeon's recommendations as NSAID use can delay your recovery and negatively affect your bone healing process. Furthermore, we want you to prepare your home for your recovery. This includes making sure you have a comfortable chair in which you can rest, clearing walkways around your home, and having all the necessary medical equipment that allows for safe ambulation while not disrupting any of your important postoperative movement precautions. Thank you for your time. Our surgical navigator will now provide additional details regarding the surgical preparation process.
Hi there, Mike again, Salem Health Spine Center Navigator. In this series, we're going to talk a little bit more about preparing for the surgery itself. So, biggest thing we want you to think about is setting up your home for success as you return home. Whether we do this 1 to 2 weeks before surgery, a month before surgery, or if you're like me, probably a day or two before surgery, we just want to make sure your home is prepared. Ideally, we want you to have a comfortable chair with a back support. So there's no perfect ergonomic chair for your surgical recovery, but we just want you to be able to sit comfortably and sit supported. Generally, we want you to have a chair that's a little bit firmer and maybe a little bit taller, so it's not so hard to get up and down from. When we've had neck surgery, if we have a chair where the back of the chair can get up to head height, that is really nice because then we can use pillows and towel rolls to help stuff that area and allow your shoulder blades and your shoulder muscles to actually kind of relax and let your head and neck be supported without having the strain of the muscles working. We really want to avoid those low chairs that are really hard to get in and out of. Or, we have those soft, squishy, kind of quicksand chairs that feel so great to cozy up into, but they can be a pain, literally, trying to get up and down from after surgery. We also want to minimize any sort of tripping hazards. So any sort of cords, throw rugs, clutter, make sure you have clear walkways to get from point A to point B. Another thing we like to think of is we really want to make sure the tools and the things that you might be using for cooking or preparing meals are kind of available to you in an easy fashion. So putting pots, pans, plates at counter height or coffee mugs just to make them easily reachable, and then you don't accidentally have to bend down to grab something or really reach up really high to grab something that you would normally use. Pets, we love them, they're great, they're our companions, they're our support animals, they're everything to us. But we really want to make sure that you're safe as you transition home, and really the highest likelihood of you falling from a pet is when you first get home from surgery. So mom or dad might be gone for 1 to 2 days or 3 days. If your dog's like mine, they're going to want to run up to you and greet you at the door, either spin between your feet or maybe jump up on you. And we don't want that. So we want your coach going through the door first, maybe bringing them to the back bedroom or to their crate, closing the door. That allows you to safely enter your home, you can get settled, and then you can invite them to you to sniff you and greet you. Help at home and meal planning. So like we talked about, the emphasis of having a coach or a support person with you for the first 24 to 48 hours is really important as you transition home to help with all those day-to-day tasks as well as to help with medication management. So when we think about meal planning, whether it's making some meals ahead of time so that way your coach or you can just heat them up easily as you transition home, or reaching out to friends, family members, support groups, church groups who have the capacity to maybe do a little meal train or bring some meals to you. Coaches, if you can, reach out to other people, especially just because your ability to maybe take a little break and allow somebody else to do the cooking will allow you to gain some more energy and to be able to better care for your loved one when you get home. When it comes to common home equipment after surgery, there will be a reference to it in the back of your guidebook, so you can always look at that. But most of the common equipment people use after neck and back surgery would be a little grabber, so you can pick things up from the floor without bending over. A toilet riser, depending upon how tall you are, having that additional 3 to 4 inches on the toilet seat with some rails just gives you a lot more ease getting up and down. We do advise people use a walker or a cane for the first couple weeks after surgery, just because general anesthesia, pain medicine, muscle relaxers all can impair your coordination, and we want to make sure you're safe and stable as you're transitioning home. Some people opt for a shower seat or a shower bench, so that way they can sit down and they have a detachable shower head that they can rinse off with instead of having to do a bunch of turning around. Grab bars, if you have a tub that you have to step up and over into, having some grab bars there to use as balance to help minimize the risk of a fall is really important to be able to bathe safely. A sock aid is a device that might be familiar to some who have had a knee replacement or a hip replacement. This is a half plastic cylinder with a wide hole that you can slide your sock over, and you can drop it to the floor with a rope attached to it and just easily pull your foot through. Some people elect to get a bidet to help with the toileting process and cleaning. Otherwise, there are other adaptive tools like a toilet aid where you can wipe some or take some flushable wipes and wrap them around and use them to clean yourself. Some people in the hospital really use the railings in the beds, and then they go home and they try to roll and get up and they don't have it. So some people may look into a bed cane or a bed rail, and those can be really useful to help getting in and out of bed at home. Most of this equipment is covered by you, the patient, versus the insurance company. So, looking at various resources within your community to help purchase these products. One thing we want you to do is to make sure you're comfortable using the log roll technique ahead of surgery. I like to think of this as like learning a new language if you're not familiar with it. So if we don't practice it, it becomes really hard to do once we've landed in a new country or we've gone into a post-surgical recovery. So here on this image, the gentleman is using a pillowcase or a pillow between the knees. That is an easier way to coordinate the movement for some. Otherwise, in your guidebook, there are some pages there that describe a log roll that don't have a pillow. And what I recommend is you try it with a pillow and you try it without a pillow and see which is easier for you. Practice once or twice a day leading up to surgery if you're not familiar with it, just so that way it's easier to do in second nature once you've had that surgery to minimize strain around your surgery site. All right, what to pack for our hospital stay? If we use a CPAP or a BiPAP machine, we want you to bring your mask along with your settings. Please bring shoes and comfortable, loose-fitting clothing. You guys are here for an active recovery process, and we want our rehab team and nursing team to practice these different daily tasks with you to make sure you feel comfortable doing them as you transition home. I'm a big believer in a little toiletry bag. Your own toothbrush, your own toothpaste, your own deodorant, just make us feel a little bit fresher and cleaner. We have generic stuff available here in the hospital for you to use as well. And then something to pass the time. Hospitals are either really noisy or quiet, or there's a lot of people in your room, and then there's nobody in your room for a little bit. So whether it's a book, magazine, your phone, tablet, iPad, and some headphones to be able to listen to music, watch shows, read, it just allows you to pass the time and it gives you a nice healthy distraction. You can bring your walker if you want to ahead of surgery, and our rehab team can look at it as they're working with you and make any necessary adjustments. And then if you have a brace ahead of time and your surgeon has given you one, please make sure to bring it with you because we'll want it on you before we get you up and start moving here on the floor. Please bring your insurance card and photo ID for the check-in process. Do bring a list of your medications. We want the name, frequency, and dosage, and we want to make sure all of that is accurate and up to date in our system. If you use any special inhalers, eye drops, or nasal sprays, you can bring those with you, and we will make sure that they are verified by our pharmacist and available for you to use as needed in your room. And it goes without saying, please leave any valuables and jewelry at home. A couple weeks before surgery, we want you to start reducing or eliminating caffeine and alcohol. So if we're caffeine addicts and we need to drink that pot of coffee in order to prevent that massive caffeine headache, we want you to start cutting down, because the morning of, we can't have you drinking coffee before you come to the OR. As far as alcohol goes, the literature does show that people who drink more than 2 standard drinks a night are at a higher risk of minor anesthesia complications. So that is one thing we would like you to minimize or eliminate ahead of surgery. Also recognizing that after surgery, alcohol and pain medicine are not safe to mix. They're both respiratory and central nervous system depressants and can lead to an unfortunate event. If you don't have sensitive skin and want to take additional precaution around cleaning, feel free to use antibacterial soap to start shedding some more bacterial layers off of your skin. And then another initiative that we've been looking at and working on with people is trying to cut back on prescription pain medicine ahead of surgery. So your surgeon would have had a one-on-one conversation with you if you've been on prescription pain medicine for a long period of time and are at a certain kind of higher dosage that puts you at a higher risk of having poorer postoperative pain control or surgical postoperative complications. 1 week before surgery, we want you to stop all anti-inflammatory medications. These are our NSAIDs, so Advil, Aleve, naproxen, Celebrex, ibuprofen, meloxicam. Tylenol is okay to use. Just follow the labeled instructions. We'd like for you to stop any GLP-1 medications. If you use them for diabetes, please talk to your prescribing provider for an alternative around surgery. If you do use them for weight loss, we just want you to skip the last dose ahead of surgery. Your surgeon will talk to you a little bit more about this individually, but we generally would like you to stop any vitamins, supplements, fish oils, and herbal medications, as they all could potentially react with anesthesia or put you at a higher risk of blood thinning or bleeding. Your surgeon will speak to you if you're on any prescribed blood thinners and let you know what a plan is around that as far as what to go to ahead of surgery, as well as when it's safe to resume your normal dosage after surgery. And then continue any of your other normal prescription medications as prescribed. Generally, about 1 to 2 weeks before surgery, you're going to have that final pre-surgical appointment at Capital Neurosurgery. There you're going to receive that specialty Hibiclens cleanser from the staff. They're going to review your procedure and expected recovery. And then they're also going to talk to you about, hey, we want you to avoid these medications, and it's okay to take these medications the day of surgery. You'll get that nice little cheat sheet from the staff over at Capital. I really like to let people know that this is the time for you to ask those final questions that you have. If you're like me, you have a laundry list of questions in your mind, you go to the doctor, you have your visit, they say, any other questions? And you say, nope. And then you walk out, you get to your car, and you go, oh, there they all are. So I advise, as you're going through these videos, as you're thinking about your surgery and your recovery, write those things down and then bring them to that pre-op appointment and make sure that they're answered by the team. A couple days before surgery, somebody from the hospital, a pre-surgical person, is going to be giving you a call, and they're going to confirm your check-in time here at the hospital. The night before surgery, after you've had your dinner, we're going to want you to go take a shower with that special Hibiclens cleanser. We're going to wash our body from our neck to our toes, and we're going to spend 2 specific minutes scrubbing your surgery site. At Capital, the MA will talk to you about where exactly they want you to scrub more specifically. After you take that shower, we want you to put on clean clothes and sleep in clean sheets. So we'd like for you to avoid colognes, perfumes, lotions, and deodorants, as well as avoiding or removing nail polish, eye makeup, and contact lenses. If you do have any body piercings, we do ask that you remove those ahead of surgery as well. And then the ever-dreaded no food or drink after midnight. Except for you guys, you may have read in your book or your surgeon may have let you know that we do want you guys to drink Gatorade ahead of surgery. So ideally, we'd like you to drink up to one 16-ounce bottle of Gatorade the night before surgery, as well as up to one 16-ounce bottle of Gatorade the morning of your surgery before you leave your house to come to the hospital. And what this does is it can make your IV insertion site a little bit easier. It also kind of primes your body and gives it a little bit of simple sugars or carbohydrates, which minimizes your body's stress response in the OR. And that actually allows you to come out of anesthesia a little bit smoother, with less nausea, better blood pressure control, and generally people are a little bit more alert. So please take advantage of this. The only color we don't want you to drink is the red one, just because it coats your throat red, and anesthesia wants to make sure when they intubate and extubate that there's no GI bleed. So at home, before you leave your house to come to the hospital. So that morning of surgery, we're going to take another shower with that Hibiclens specialty cleanser, and we're going to put on clean clothes. We're going to spend 2 particular minutes, again, scrubbing that surgery site area. We're going to take our morning medications as instructed by the neurosurgeon's office with our Gatorade. And then we're going to get in the car, and our coach is going to take us to the hospital, and we're going to report to the surgical check-in area, which is on the 2nd floor of Building A as in Alpha. When we get to the hospital campus, there's a couple different places you can enter. So do not try and park under Building A. That is a physician-only or staff-only entrance and exit. So what we advise is you either park in the patient visitor parking garage and walk past the emergency room to the main hospital entrance, or your coach can use either the Oak Street turnaround or the emergency turnaround to drop you off if you have a little bit more difficult time walking. To get you into the lobby, they can go park the car and then meet you and then take you up to the surgical check-in area, which again is on the 2nd floor of Building A.